Hello, I'm Bucheon, a breast surgeon at Bucheon St. Mary's Hospital. Normally, what patients would call anti-cancer therapy would be the process of chemotherapy, which is a set of drug treatments. As the drugs would be injected through the blood vessels, chemotherapy is considered a type of systemic treatment, and patients would normally get shots every 3 weeks. And the frequency of these shots depend on the stage of cancer, and it also depends on the type of the cancer, as well as what type of drugs are being used. The most common case in frequency is getting around 8 treatments, as it takes about 6 months as it happens every 3 weeks. But when it's in the early stage, and if it didn't spread to the lymphatic gland, the treatment can be cut down in half to just 4 treatments. And when it comes to chemotherapy, it can cause side effects as it is a systemic therapy. Compared to other adjuvant therapy, side effects can appear more frequently. The most common side effect is hair loss, but it only happens during chemo, and the hair will grow back once the chemo is finished, so you don't have to worry about that. And various digestive side effects can occur, including nausea, constipation, and diarrhea. Patients may experience several other symptoms as well, but most of them are pretty much bearable. In the cases of these side effects that occur, we can manage the severity to some level using drugs, so we can alleviate the symptoms. Well, chemoendocrine therapy is also called anti-hormone therapy. This therapy is used for a patient who has the hormone-positive breast cancer cells. And if that is the case, hormone treatments will be used, and the treatment types depend on whether if it is pre or post-menopause. For the post-menopause patients, we use the aromatase inhibitor for about 5 years, and for pre-menopause patients, we then use a specific drug called GnRH, and the patients will be regularly taking a pill called tamoxifen for 10 years. Radiation therapy, just like the name, is using the radiation beam to the surgical area. So as I mentioned earlier about the surgeries, a full incision doesn't leave any breast tissues. Therefore, radiation therapy is not necessary. However, if cancer spreads to the lymphatic gland, radiation therapy can help prevent cancer recurrence. Under cooperation with radiation oncologists, the range or times of examination can be considered. And in the case of partial incision, the surgical area will go through the radiation treatment, and generally, it will take around 20 treatments. So one could consider that the treatment will take around a month. The targeted therapy can be categorized as sort of drug treatment as well. The targeted therapy can only be processed depending on the patient's cancer. As I mentioned earlier, with anti-hormone treatment, when the receptor that enters estrogen and progesterone is positive, the treatment is possible. When HER2 factor turns out positive, the targeted therapy can be processed. Typical drugs include trastuzumab, pertuzumab, and T-DM1. Typically, starting from 18 cycles, you need a full year of treatment every 3 weeks. Yes, today we talked about when the patient sees a doctor, through what process the surgery is decided, how it's processed, and how supplementary is processed after the surgery. Thank you.